This is a quick review from the Claywell book, Care and Safety Standards, Competence, and Nurse Accountability. 3 objectives to describe accountability, identify the RN's role in managing care, and describing how to use the chain of command. Part of Care and Safety Standards is knowing your role as you progress with experience as a nurse. And this comes from Patricia Benner's research from novice to expert. A novice, in general, is rule-driven. Concrete thinker and believes and trusts whomever has authority or whatever direction is perceived to have come from someone in authority. Novice nurses may ask the help of other more experienced nurses, and it's good when a novice nurse makes their learning needs known and is prepared to take on new learning experiences and is thoughtful about the learning that is taking place. The novice nurse is confident enough to ask questions, seek clarification, and seek constructive input. They understand that experience is needed to gain expertise and will open a dialogue with the mentor. The novice nurse is clear, precise, and thoughtful in the questions asked and in the dialogue that follows. They're hungry for learning experiences, and they demonstrate this through a sound plan and focused on the matters at hand. The advanced beginner is a new graduate nurse with marginally acceptable performance who relies on other experienced nurses. This is a level that some graduates begin with, and they gain experience in the field and demonstrate a solid performance. The competent nurse is able to multitask, set goals, and think analytically, usually 2 or 3 years in the new role. Develop safe organizational skills to get through the day's task efficiently. Flexible within the nursing role is difficult to manage at this point, and when deviations from the schedule occur, the nurse generally has a feeling of unease. Competent nurses have developed skills and are routine-driven, often struggling with flexibility. A proficient nurse is experienced and has a beginning ability to recognize patterns and think critically. The proficient nurse sees the whole and focuses on long-term goals, and the level of the expert nurse is reached after considerable experience because they recognize patterns and have responses that are automatic and integrated. And an expert nurse has had a great deal of experience. They're flexible and adaptable and respond to change with ease. According to Benner in 1984, the expert nurse is a skilled critical thinker who has gained experience and skills through practice. Primary competencies, looking at QSIN. The Quality and Safety Education for Nurses project addresses the challenge of preparing future nurses with the knowledge, skills, and attitudes necessary to continuously improve the quality and safety of the healthcare systems within which they work. Accountability is being answerable for the actions or interventions one performs as a nurse. Accountability also means taking responsibility for their growth. Although individuals are ultimately accountable to themselves, the RN is particularly accountable to the patient, society, and the profession. The RN should report the incident immediately to a charge nurse and surgeon in the best interest of a patient if there is an error. Patient-centered care is one of the 6 primary competencies in the QSIN project, and patient-centered care involves involvement of the patient as well as medical personnel. The treatment plans are tailored to fit the patient's needs and lifestyle, and this helps set the patient up for success. The basics of a root cause analysis. This occurs when there is a lack of timely and appropriate response to changes in a patient's condition, like failure to prevent a clinically important deterioration, such as a death or something that leads to permanent disability. Failure to critically monitor patients carefully and identify deteriorations in order to intervene appropriately, because not doing so could lead to a sentinel event. In a root cause analysis, a committee is formed, which could include a facilitator, like a risk manager or a performance improvement director, as well as the nurse or nurses involved, a pharmacist, physician, a team leader, or even a supervisor. The purpose of the committee is to reconstruct the events leading up to the error. By looking at the process, the committee may discover that a physician's order was unclear, that 2 drugs had a similar name and they were placed next to each other in a medication dispensing unit, or that the unit of measure for the drug was unclear. This is a list of never events categorized into 6 areas, and the National Quality Forum has a 3-part mission: to set goals for performance improvement, to endorse standards by measuring and reporting on performance, and to promote educational and outreach programs. If a colleague made an error and it was not reported, that the nurse not reporting is also held accountable. The RN must act judiciously and prudently in the delivery of care. By not going to the supervisor when a mistake was made and failing to demonstrate accountability for contributing to the mistake, the RN risks not only harm to the patient, but also potential legal and ethical consequences. In all instances, use the chain of command. The manager has a responsibility to meet with the nurse involved in the error and create a plan to help ensure that the error does not happen again. And this can be done by setting up a time in which to educate the nurse about the 6 rights of medication administration. The nurse should not ignore the error, ask someone else to handle it, or use an incident report in a punitive way. Never events are events that should never occur in healthcare, including wrong site surgeries, patient suicides, and the unintended retention of a foreign object in a patient after surgery. Because never events are devastating and preventable, healthcare organizations are under increasing pressure to eliminate them completely. The Centers for Medicare and Medicaid Services state that Medicare will no longer pay for additional costs associated with many preventable errors, including those considered never events. Many states and private insurers have adopted similar policies, and since February 2009, the Center for Medicare and Medicaid Services has not paid for any costs associated with wrong site surgeries.